Next is the Plan, Do, Study, Act cycle. The Plan, Do, Study, Act cycle is a four-stage problem-solving model used to improve a process or create a change. The key questions that this method focuses on is, what are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in an improvement? A healthcare organization must first create this culture of safety. This should be the overall goal of any organization to not only prevent medical errors but improve patient safety. Management will need to work with pharmacy and IT in order to create a new barcode label for each insulin medication. To implement this technology, management will need to focus on implementation of communication and workflow technology, placement usability, and training with go live preparation. Now, management will need to make a committee dedicated to implementing this technology within 3 to 4 months. With each insulin medication, pharmacy will create this label that is compatible to scan on a computer chart. In our hospital, we use iMed. There are Cerner, many different types, as long as it is compatible. If the insulin medication does not have a barcode, then the nurse will have to call pharmacy to create a label before use of this medication. There must be an implementation of the FDA rule on barcoding, which mandates that all hospitals place linear barcodes at a unit dose level. To ensure that the nurses know how to use this equipment, technology management will have a course that will be at least 4 hours long and also be able to incorporate into learning practice. There will also be a super user, which is just a nurse, pharmacist, or other staff member that had extra training on the system. And this is important because some users may need additional support if glitches or maybe some technological problems come up. Following the completion of a pilot insulin medication barcode, we will test this tool on the telemetry medical surgical units, and they'll participate in a 3-month study to determine the effectiveness of reducing medication errors. Now, we're doing telemetry medical surgical units because we do not want a higher acuity compared to like intensive care unit or the emergency room. The technology system can also gather data on the number of times a wrong medication alert has been created. This can give more information how often this is occurring. If proven to be effective after the study, then management can utilize this tool in other units so that we prevent medication errors in the hospital overall.